Thank you very much for the very kind introduction, and I feel a little bit intimidated being with this wealth of expertise in healthcare. I was just a patient that saw a need and nudged the system to make a few things happen. It's a story about people who get disconnected because of a disability. As someone has stated already, we've got this gray tsunami that's hitting us. It's going to have a profound impact on our healthcare system and our governance. And the big challenge will be resources, and collaboration will be required, not just within Nova Scotia, but perhaps across the country, to fund things that are required. Along with it will come a disabilities riptide. Again, we lead the country in this. 20% of our population currently has a disability. It will grow to about a third by 2026. Very significant amount of people. Accessibility will become a huge issue in Nova Scotia. Becoming disabled can happen to anybody. It happened to me. I was working very hard in Grenada, as you see. And within a day or two, I was at the infirmary, at the emergency, with the chaplain standing over me, basically giving me my last rites. They saved my life. I'm blessed. Unfortunately, my condition put me in a wheelchair. Upon reflection, one of the big disadvantages being disabled is that you lose independence to a large extent. I'm fortunate. People with severe disability also become disconnected because of the difficulty of accessing technology, both communications and IT technology. This needs to be corrected. I'm a bit of a gadget freak, so when I entered the rehab center, I gave up a single room to be with 3 roommates because there was a router next door. And and this is where the story really starts. It's serendipitous in a way, what happened to me by taking some roommates. One of my roommates was an elderly patient in his early 70s who had fallen, broken his neck, and became paralyzed from the neck down. He saw me playing with my iPad in my bed, and he was asking about it. And within a few hours, I had him operating the iPad using Siri, the voice-activated system, and he ended up communicating with his granddaughter in Calgary. It opened our eyes. I had time. I was there for 3 months, and then when I was there, I was starting to do research on what was available for adaptable technologies. A lot is available. Some is very expensive, complicated, and we can't all be Stephen Hawking to operate it. And those with severe disabilities, many of them live below the poverty level. The other thing I discovered is at the rehab center, they excel at the traditional practices of physio and occupational therapy, but very little was happening on the IT front. I think what it is that it takes time for large institutions, professions, to turn their ship around. In the meantime, technology is accelerating at the speed of sound. This resulted in a proposal that I put together, which was accepted immediately by the co-directors of the center. And they appointed Kim Parker, who is standing in the picture there, as a part-time person to work on the project. And she takes all the credit, or should take all the credit for what you see in the future slides. We had 3 objectives. One was research, to find out what the best breed of technologies are out there. Second was to bundle them easily for clients. And third was to disseminate, including training. And these objectives are currently being met. We, of course, worked with various patients to refine the bundles. This is Linda. She's paralyzed from the neck down, and she's using 2 technologies, a switch under her chin and voice, to activate not just her computer, but also external devices like her television. Our next patient is Justin, severely disabled, could not speak. Here we adapted a technology called eye gaze, where the pupil is calibrated with the computer, and your eye becomes the mouse. And he became very adept at communicating with his family through doing that. Our third example is a lady, Catherine, who used her mobile phone to communicate and activate various external devices around her home. It becomes very difficult if you cannot lift your hand to turn on and off the lights, simple things like that. And using the Bluetooth technology, this is now happening and currently available. Now, the United Nations a few years ago adopted internet access as a human right. Obama has initiated a major initiative to get free access to internet throughout America. Perhaps our government will follow suit. Our project is still very small. We're still playing in the sandbox, and we need to get out of the sandbox. And my hope is that we establish an IET lab, follow the example set by Dr. Lee Kirby with the wheelchairs, and move it into the next generation of technologies. And do it collaboratively, perhaps regionally, amongst partners. The vision that we have, and the hope that we have beyond that, is for it to be a collaboration between the community. I see community partners like the private sector, NGOs, academia. I also see our student population, perhaps in occupational therapy, to become volunteers, to train those in need using the technology. And I also see an opportunity for a social enterprise in this field. I will keep this under wraps for the moment. We have organizations, NGOs, like the March of Dimes, who've noticed this. They now have a free giveaway program of e-tablets to those that cannot afford them. It's very encouraging. But those recipients will need help to use and to be trained. Now, you remember Justin that I showed earlier. It's a bit of a bittersweet story. 3 days after this picture was taken, he passed away. Before he passed away, he was able to compose his thoughts and last wishes and say goodbye to his wife using the technology. Very powerful. And I'll leave you with this last thought. For most of us, technology makes things easier. For a person with disability, it makes things possible. Thank you.